This is Pet Life Radio. Let's talk pets.
All right, and welcome. You're here live with Dr. Jeff Werber, your host for the next 30 minutes here on Pet Life Radio and Instagram Live. Here for you, here for your pets. You know the drill. You want to get a hold of me? Easy, right here on Instagram Live. Just do what you're doing. Wave to me, and I will wave you back. Bring me your questions. Love your questions. And here on Pet Life Radio, either give us a call the old-fashioned way, 877-385-8882. Once again, 877-385-8882, or better yet, if you're here, that means you're already on and you're watching us, then you can just get your pet on your lap and go ahead and start asking away. And while I look to the side here, I am waving and hoping that we get some questions, good questions. Lots to talk about. As always, I'm never at a loss for words. That's one thing I can promise you. So, and I hope you had a good week. And here, gorgeous day in LA today. Actually magnificent. I am actually heading to the Rams game today. They're not very promising, but at least I have the tickets. I may as well use them, right? And sometimes I go more for the pregame activities of tailgating than I do for the actual game. But last game I was there a couple weeks ago, they pulled out a winner at the very end, so that was pretty cool. All right, so hope everyone is doing well, enjoying our beautiful weather here in Los Angeles. It's gonna be beautiful and sunny today, and I want some questions. So in the meantime, obviously it's on the top of so many people, including mine, and that is, what is going on with this respiratory virus? What do we know about it? And the sad truth is we really don't know a lot about it. We don't even know if it's a bacterial infection or viral infection or a mycoplasma infection. Even the experts don't even know. We're hearing on the one side from the Veterinary Diagnostic Lab at the University of New Hampshire that they feel it's a bacterium. And they've never seen it before, don't know what it is, and they're having a tough time growing it. Usually when you have bacteria, you can grow it on what's called an agar plate or some sort of vehicle where the bacteria actually can multiply and multiply. Then what they do is they can test the bacteria with these little antibiotic discs, and discs for almost every antibiotic you have there is available. And they look and see an area around the disc, how much of it is now dying, the bacteria. The more and the faster they die, the better that an antibiotic is for that particular bug. Well, they have not been able to even grow it yet. And because the antibiotics seem to be relatively ineffective, except this one called chloramphenicol, we'll talk about that in a minute, that they think maybe it's a virus. So, again, we're seeing a lot of opinions. A lot of vet schools now are chiming in. My good friend Mike Lappin from Colorado State is chiming in. He's seen an uptick in cases of respiratory infections. But he made a very interesting point. Because of all the news, we may be seeing more animals being brought in and thus reported than we did when they just thought it was a cold or a little cough. We don't run to a doctor every time we get a little cold. So why would you? And especially if it was a mild cough, maybe the dog was at the dog park, and they don't think twice about it. So they're up to date on their bordatella vaccine already, their influenza vaccine. Give it a few days. Now with this new bug, of course, they're going right in. So that is one of the concerns. And secondly, what this Scott Weiss, another veterinarian in Canada, talks about just more of an awareness. The reason why we're seeing more cases, there's more of an awareness of it. Interestingly, Trupanion, one of the big pet insurance companies, has been reporting more and more claims for respiratory infections. So we do know that it's there. Some of the experts are saying, don't run and rush to start antibiotics. First of all, it may be viral. And if the dog is not sick, then you don't want to use antibiotics, because what happens is the more we misuse antibiotics, the more likely we're going to get some what we call resistant organisms. And that would be disastrous to have resistant bugs, because then when we have an infection and need them, we're not going to have them. Which then leads us to the next point, and that is what's going on with this chloramphenicol. So I have one case of all the respiratory cases I've seen, and because there was pretty severe pneumonia. So first of all, let's get a diagnosis. Let's see how sick is it. If it's just coughing, then treat it symptomatically. And if there's pneumonia, then we may need to use antibiotics. And since it was a pretty bad moist infection, I started on chloramphenicol. I don't love it. There are some human health hazards. You should definitely wear gloves if you're going to have it administered. But seems to be effective. I'm sure you saw the study about a case in New York where the dog was like on death's bed. They started chloramphenicol and we miraculously recovered. So was it because of the chloramphenicol? Was it because, did they try other antibiotics first? There's a lot we don't know. So bottom line is be vigilant, kind of keep your pets away from these areas where there are a lot of pets. So that means dog parks. That means doggy daycare, boarding facilities, grooming facilities, etc. If you can, just until we know more, a little bit more about it, and make sure they are up to date on their other respiratory vaccines. Because there's something called, and we heard about this term a lot during COVID, comorbidity. What does that mean? Comorbidity means that it by itself, okay, probably won't cause many symptoms or wouldn't be very severe. However, if the patient is already compromised because of another disease at the same time, so their immune system is already weakened, then that same bug, which otherwise would not have caused a major problem, now is causing a major problem. So we call that comorbidity, and we're seeing that as well. So anyway, got some questions here. So let's go backwards. And how do you deal with separation anxiety? All right, with looks like a Maltese Shih Tzu or Shih Poo mix. Separation anxiety is pretty much always the same. We make a lot of mistakes. So sometimes the separation anxiety we're seeing is our fault. And that is how we interact with our dogs, even when we're not gone, even when we're home. How dependent are they on us? Have you taught them that, it's okay I'm home, but I'm not going to be with you every minute. Why don't you go here? Here's a toy. Why don't you play with this bone for a while? Or let me get you a game where the game itself provides the treats. So it teaches them to interact not with you to get reward, but with an inanimate object to get the same reward. So that's one thing. Second thing, we when we're leaving our little pet alone, especially if it's a new pet, we're so upset, as they are, to be left alone. So what do? We coddle them before we leave. We give them hugs. We go, we're going to miss you so much. Hug, kiss, right? And then you walk out the door. And they're going, wait a second. What about me? You're not taking, what's going on here? And then when you come back, what do? You miss them so much, and obviously they miss you. So you pick them up, big hugs. You just, go on a joyous reunion. It's only been 2 hours or 3 hours or 5 hours, whatever it is. So what's happening is they start longing for you. They start missing you. So some basic things are, of course, as we said, get them to be happy on their own. Every time you're sitting on the couch, they don't have to be on your lap. Give them something to enjoy. Every time you get up from the couch, let's say you want to run to the kitchen, you got to go to the bathroom, whatever. They don't have to come with you. You make sure they stay. All right. That's number one. Number two, when you leave, don't make a big deal about leaving. What you want to do is get them their toy, their treat, have them in a different room. You should already have your coat and your purse or your whatever you're taking with you, your book bag, your backpack outside in the car already. And you gradually kind of walk out of the house quietly. Don't make a big deal. When you come home, also, don't make a big deal. You walk right by them as if that dog is not even there. And you totally ignore that dog until the excitement settles down. With the same recommendation, when you have dogs that are what we call submissive urinators, they get so excited when they see you, they're squatting and they're peeing all over the place. I had a friend's dog. Anybody can go to their house. Anybody can go to their house except me. When I would go over, she would pee right away all the time. It was crazy. She would go nuts when she saw me. So, I was the only person. We tried everything. I tried to go in with the girl. As soon as she saw me, she ran over, squatted, and peed. So, but dogs do that. So, again, you want to just wait till the excitement of you coming home is sort of worn down. And then you can offer, don't look at her, no eye contact, and offer her a little pet under the chin, right? A little something, good girl, good boy. And then slowly, gradually, sort of reestablish that relationship. So these are some of the things to try. And of course, lastly, my last resort, drugs. I first would recommend things like my Chill. It's a natural supplement with chamomile and valerian and passion flower and melatonin. It's great stuff. You can get online, just called Chill, because that's what we want them to do. We want them to chill. And then, of course, if it's worse than that, there are some other drugs that you need to talk to your veterinarian about. But anyway, try those things first, and then we'll talk. Now, is it safe to walk your dogs now with this flu? Yes. Again, it's pretty much direct contact where the dogs have to breathe on each other. It's not something that is floating. So I remember back in the COVID days, I see people walking in the street with nobody around them with the mask on. It's like, come on. It's not that it's floating around. It's going to get you. It's not chasing after you. So it's the same thing. You can walk them if they, interact with, or you see other dogs that they may know and they want to come and smooch and get that, you should try to avoid for now. Again, until we learn more. But again, make sure that your dogs are up to date on their bordatella and their parainfluenza vaccines. That's very important because again, we want to prevent some of that comorbidity. Let's see what we got. We have an 11-year-old Corgi friend. There is a tremble with her. Give me more. My wife, Corgi's finished. I'm sure you finished it somewhere. I'm going to go look. Spoke with you last week about Stella back from hematoma. They did surgery. She had a cone and mesh holding her ear together. Also went and got gabapentin and cephalosporin. Okay, that's great. As we discussed, there are a lot of different techniques for fixing the ear hematomas. I am a fan, by the way, of having something done surgically. Trust me, my first attempt is always, let me stick a needle in this thing. Let me drain it. And let's see. I mean, maybe a 1% chance that it won't come back. It's going to come back. I mean, if you're an odds guy and you're betting, yes, it's going to come back. But I've had 1 or 2 or 3 in my practice career. It's only been almost 40 years that have not come back. But that's why, as I said, very low probability, but it does happen. You can get lucky. Normally, it's going to be a surgery. Number of surgeries out there. I started with the surgery I'm doing now is the one I did 35 years ago. In between, I read some other things. There were some other new things came out. That sounds good. Let's try it. It just didn't work the same for me. Putting in a little cannula, allowing it to drain, finally it'll stop. There was one where they had these little buttons, almost looked like shirt buttons, that would go in from one ear to the other. You didn't have to make the slice in the ear. It did the same thing. It would actually eliminate all the dead space. But I found with that is that, yes, the bleeding will ultimately stop. But as soon as you take them off, you've done nothing to provide like a permanent scar to keep that space closed even after the sutures are removed. So I went back to the good old-fashioned way, and it's been working fine for me. And the pain meds, gabapentin, cephalosporin, Simplicef antibiotic, all that is good. All right. I got 2 of my 3 sibs are here, which is nice. At least someone's listening to me. They never listened to me when I was at home. We were all living together. I was never heard. Now I'm saying something and they come and listen to me, which is great. So they say my doctor dog has been vomiting for a day or 2. That's a great question. Thank you so much. One of the most common things, and this is what I noticed as I said, as you know, I'm chief veterinary officer of AirVet. I co-founded it. My son Brandon runs it. We are the number 1 telemedicine platform in the U.S. People love it. They really do. To have a veterinarian in your back pocket, access 24/7 care. And people say, what kind of calls do you get? And, I get, obviously, my dog ate a raisin or chocolate, some fear of toxicity. I get the limping, an acute onset of limping, not an emergency. I get the vomiting and diarrhea. All right. And again, may or may not be emergency. The reason I love these calls where it's on video, because I've said this before, they say the expression, a picture is worth 1,000 words. A live video is worth 100,000 words. So there is so much you can tell just by observing your dog. Yes, it may be vomiting, okay? But how often? What's coming up? Can he wait for his next meal? Is he drinking water? I mean, what is going on? Is he vomiting too much after he chows down a bunch of water? Well, again, that is a very important piece of history. Why? Because vomiting breeds vomiting. Once a dog starts vomiting, picture like taking a wet rag, a washcloth, and wringing it out. That's kind of what the inside of his stomach looks like, having gone through vomiting. Now, anything that goes in that stomach and stretches that stomach wall, even something as benign as water, will make him vomit again. So the first thing I recommend, yes, obviously they're not stupid. They're trying to reestablish some fluid balance from losing the fluid in the vomiting. But you got to be careful. They can't do it too fast. So I recommend usually taking an empty water bowl, depending on the size of the dog, anywhere from 1 to 10 ice cubes in the bowl. Let them slowly melt. And as the ice cubes are melting, they can walk up to the bowl and lap up some of the water. But it's unlikely. They won't be able to take in too much at one time. So it's sort of like is pacing how much water you can give them, how much water they can drink without you needing to sit there with the pitcher and just dropping it in a little bit at a time. What comes up? What's their attitude? Again, it makes a big difference. So vomiting for a day or 2, and I say, how long after a meal? Is there any way, think about it, always get a good history. Is there anything, you know your dog's best. What is the likelihood that he or she ate something that was not to be eaten? Whether it's something that had a toxic effect on the stomach, whether it was something that like a rag or a sock or a ball or a piece of a chew toy. You walk up. I had this cat that they saw it was chewing on a ribbon. And by the time they got to the cat to pull the ribbon out, it was gone. And they looked everywhere. That cat ate the ribbon. It was about 20 solid inches long. Now, if it had something on a knot on the other, first of all, I always check under the tongue. But if there was a knot, something that would not make it past the stomach, I'd worry because then it gets stuck there, but the intestine is still trying to push it out. And we get what's called an accordion effect. And that can actually rip through the antimesenteric border of an intestine and cause a huge problem. But there was nothing on this. It was a flat piece of. So really, we saw, at first we saw something in the stomach on x-ray. Some food was attached to it. Long story short, 4 days later, this cat would not eat, felt like crap. They had to force feed it because you can't have a cat go more than 3 days without eating. And anyway, but I could see stuff with x-rays, follow-up x-rays. There was no evidence of plication. The ultrasounds were showing everything seemed to be working okay. And a lot of stool building up, but this cat wouldn't poop. So what do we do next? We do enema. And I'm going up digitally to try to grab this thing out. And what do I see in this little clump of poop? The ribbon. Start pulling it out. And we got it all, and the cat is 100%. So anyway, you want to make sure they're pooping on one end, and I'm saying don't ignore it. If it's 2 days, I would at least have the dog evaluated. Your doctor can palpate the abdomen, especially in a small dog. It's easy to palpate the abdomen. You can take an x-ray, see what's going on, an ultrasound, and to see if there's a reason for the vomiting. And of course, if the dog is dehydrated, you want to obviously get some fluids, either subcutaneous or IV, again, depending on how bad and the size of the dog. Subcu fluids are pretty good, can work in small breeds. If the dog gets too big, subcu fluids aren't going to work that much. You got to go IV. And lastly, medications to stop the vomiting, the emesis, and see what happens. Anyway, it is time for a break. We have a lot of waving, and I see we have some questions coming back up. So why don't we take our break here for Pet Life Radio? And those of you who have not yet asked a question, there's another question coming up. New York Yankee. I'll get to that in a minute. Talking about kidneys. Love that. Those of you who have questions, get the courage up. So to ask them, we'll share it with everybody. Everybody wins when we get these questions answered. And we'll be right back after these short messages from Mark. Go ahead. Take it away. We'll be back in a minute.
Take a bite out of your competition. Advertise your business with an ad in Pet Life Radio podcasts and radio shows. There is no other pet-related media that is as large and reaches more pet parents and pet lovers than Pet Life Radio. With over 7 million monthly listeners, Pet Life Radio podcasts are available on all major podcast platforms. And our live radio stream goes out to over 250 million subscribers on iHeartRadio, Odyssey, TuneIn, and other streaming apps. For more information on how you can advertise on the #1 pet podcast and radio network, visit PetLifeRadio.com/advertise today.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
We're back. We're just answering a question about, we talked about bordatella. How often should you get a bordatella vaccine? Once a year, twice a year? What's the story? So quickly, with the bordatella vaccine, it's the best one we got, but it's not a great vaccine. First of all, it's not really, by definition, it's not a vaccine. It's a bacterin, because we're giving it against a bacterial infection. Vaccines usually imply viruses. So it's a bacterin. And it's really good for, they say, about 4 months. So if you're only going to do it once a year, then you got 8 months of non-protection, 4 months of being protected. Which 4 months? Well, you can do it during the time that maybe if you have a life cycle where they actually do spend more time during the spring or summer at these daycare facilities, to go to a dog park more often. All right, you have a little justification. But so my feeling is this, and I tell this to my clients: if you have a backyard dog like mine, because my dogs have their own pack, I no longer, because of their horrendous behavior and with other dogs, to be mingling with other dogs unless they know them. I have friends, neighbors that I take my dogs over. They're great. But strange dogs on the street, strange out the dog park, my dogs are embarrassing. But they have so much fun together, so I give them once a year bordatella. If you are frequenting a place, and a lot of them, by the way, these doggy daycares, these pack walks, a groomer, many of them, or boarding facilities, are requiring bordatella every 6 months. So I would agree that if the potential for an exposure is great, then you want to do it every 6 months. So that would be my recommendation. How long is too long to leave a dog alone? It really depends on the dog. There are some dogs that are gone alone all day long. You go to work or school, whatever, in the morning, and you don't come back till 5, 6, 7 o'clock. If the dogs are trained that way, as long as they get the attention and affection and good quality time with you when you're home, don't overdo it, and you have a dog that doesn't have separation anxiety, we should just repeat that, then it's fine. I personally, if I had one such dog and I knew that I was going to be gone for many hours during the day, 10 hours during the day, I would not have just one dog. I would have many dogs. And I find that my dogs, they sort of take care of themselves so much that sometimes they don't even care when we're home. They're out having a blast with each other. And that's fine too. Sometimes we have this syndrome where dogs bond with each other so much they don't bond with the parents, the human parents. So could that happen? Yeah, I have yet to have that happen to me. By making sure they get plenty of love and affection when you're with them. I have not that. They love us, but they love us more than they love each other, but they do love each other. All right. How much fluid should an older dog have? How do we take care of their kidneys? Thank you. So it really depends. From a water intake, just a rule of thumb is 100 milliliters, okay, per kilogram body weight per day. So you can take that, you take 100 mils. Remember, 30 mils is an ounce, okay? 8 ounces is a cup. So 230, okay, times 8. So again, it's 30 mLs per ounce times 8 ounces. 240 mLs is a cup. So say 250 to make it easy. So 4 cups, right, is 1,000, is a liter. And that's, you just kind of go by that. If they're drinking much less than that, then you might see some changes on their blood work, indicating a bit dehydration. If they're drinking a lot more, then you have to look, why is my dog drinking so much water? Is it a urinary tract infection? Is it diabetes insipidus? Is it diabetes mellitus? Is it Cushing's disease? There are certain diseases that dogs seem to drink more. So you have to check the kidney disease, because that is one of the things. They might drink more water than normally. So as far as administering of fluids, it all depends on what the fluid loss is. There are charts that, depending on what percent dehydration, all right, the size of the dog, the weight in pounds or kilograms, will tell you what their maintenance is, what their twice maintenance is, what their 3 times maintenance is. All depends on their degree of dehydration. Whether is it 5% dehydration, 7% dehydrated, 10% dehydrated. So these are what we determine, and it goes a lot based on their weight and the degree of dehydration. Trembling and shaking in her hind legs and butt is happening when she's excited and walking. Well, if it's exciting, I've seen dogs that get so excited that their whole bodies are shaking even after the initial excitement has died down. I'm not saying, again, would justify an exam. There are some things that, when you have a sick animal or animal is doing something weird, there are 2 reasons to do a full exam. One is to rule in a problem, and the other one is to rule out a problem. And there's nothing wrong with doing a bunch of tests and getting them all perfect, negative results. No infection, no organ involvement, no disc. That just tells you have nothing to worry about. When your doctor does exams, does tests, and you find out everything is good, don't you breathe that sigh of relief? Right? That's exactly the same with dogs. That's what you say. Don't say, oh my God, why we wasted money on that test. No, you didn't waste money. You got answers. And the answer was a good one, but you still got an answer. So I am not rushing. If I can avoid testing, which I often do, by my thorough physical history, waiting it out. And I often say this, that I will treat, think about it, and people think, when I first say it, they go, why? I will treat an animal differently on a Monday than I will on Friday. Why is that? Because if I'm very conservative in my approach, I don't like to start doing drugs and testing right away. If I can help it, I get my hunch from a full physical and a good history. That's going to give you most of your answers right there. So if I'm worried about something I want to see, but the dog's acting okay, and it's Monday, I still got Tuesday. I got Wednesday, right? I can see if things are changing. I say, come back in. I don't charge for my recheck exam because of that. I don't want people to think, oh, yeah, you just want me to come back. So you get it. No, my recheck is free. But the test that I held off on Monday, I may need to do by Wednesday. On Friday, well, I'm closed on Saturday and Sunday. So I'm not going to see that. Now I have to wait till Monday. That's 3 days. I don't want to risk it sometimes. So if I'm sitting on that fence, right? Should I take a test? Should I not? And it's Friday. I'm going to probably do the test on Friday. So give the owner and myself that peace of mind going into a weekend for sure, instead of just, educated guess. I'm usually an educated guess kind of guy. So anyway, I know it sounds crazy, but that's just me. All right. Who wants me? That's okay. I'm going to ignore that for a second. 11-year-old boxer started sitting sideways more often. Is this an indicator of hip issue? A lot of dogs do that, and we take x-rays and the hips are fine. I would still, yes, you want to rule it out, but I would say I would like a video of this dog walking and running. And that to me is going to tell me more than the x-ray. Why is that? Because I have dogs that are clinically doing great, and I take an x-ray and see arthritis, but it's not bothering them. Conversely, I've had dogs that I take an x-ray and they look good, yet the dog clinically is not doing well. So the question is, am I going to treat the x-ray or am I going to treat the dog? So that's why for me, along with the testing, that's why I love I love video. And I would say to people all the time, if there's any kind of questionable limp, next time this happens, what happens when they come in? When they come in, you got the adrenaline going, right? There's other dogs, they're getting excited, and all of a sudden they forget about their pain and they're not limping or they're not favoring that leg like they were at home. So it doesn't do me any good. So I say, you know what? Next time it happens, grab your phone, take a video. I want to see what you see at home, and then I can help make a decision as to what's the best thing to do next. So that's what I would say here. If it's only when she's sitting, but otherwise doing fine, I'm not worried. Would I say smart to take an x-ray? Absolutely. 11-year-old boxer should have an x-ray anyway, if it was perfect at 11 years of age. You want to rule out things like arthritis because there are natural things that we can do, even if they're not very painful, that can help them as they hit that 12-year-old and hopefully 13 for a boxer. That would be pretty cool. All right. Let's go back to the corgi. Shaking tummies more and more. That's another great point in history. It's progressive. So when things are progressive, then it becomes a little bit more concerning to me. When things happen suddenly, we call it an acute onset. Then I'm thinking about maybe some sort of injury, an episode, something happened. But if it's a slow progressive disease, now we're talking and looking for a number of things, whether it could be a cancer, whether it could be severe arthritis, whether it could be some joint degradation, something is going on. So yes, with the corgi, I would start looking at the back, 100%. All right. I'm not so smart. I maybe more lucky than smart, but thank you anyway. All right. So let's see what we got here. So the x-rays, there's a thing. When the x-rays are good, and I can do it what we call tracheal sensitivity, I touch the neck and I can induce that dry, hacky cough. I'm thinking it's probably just kennel cough. And if we want, I always say this, once you start an antibiotic, the reason why we often get the resistance in proper use, once you start an antibiotic, even if you find out maybe we could have done without it, still complete at least a 7-day course, preferably 10, but 7 days. In humans, it's usually 5 days. What we don't want is to start, wait 2 days, because this is what happened. If you have a bug, you truly do have a bug, and it's not a serious bug, but it's a bug. And now you stop antibiotics after 3 days. The course should be at least 7. So what happens? After 3 days, some of the weaker bacteria, the older bacteria, whatever, are gone. But you still have the stronger ones are still left. If you stop your drugs and don't go at least to the 7 days, preferably 10 in dogs, then you have not killed all your bacteria. So which bacteria are left to breed and to multiply? The ones that were stronger. So that's how we create bugs that are laughing at the antibiotics. So even if there's no downside, when would I stop an antibiotic short? If the dog wasn't doing well. If the antibiotic was causing severe vomiting, we know some dogs don't tolerate certain antibiotics well. And then I would switch to another antibiotic. You don't want to just stop an antibiotic. So my hunch is that if we did it, I'm thinking more of good old-fashioned kennel cough. Let me tell you about CCL surgery. I have an appointment with an orthopedic surgeon this Tuesday. Okay, CCL is a cranial cruciate ligament. It is the equivalent of the human ACL, which is anterior. In nomenclature, we call anterior cranial the same. Okay, caudal posterior the same. So ACL is CCL. So depending on many factors, age of the dog, size of the dog, there are 2 major accepted procedures nowadays. The one that by far most orthopods are using is called the TPLO, tibial plateau leveling osteotomy. It is a great procedure. And then what makes it so special is that whereas the others, like the lateral suture, the extra capsular approach, which still works in small dogs, it is trying to recreate the ligament and the effect that the ligament has and the relationship the ligament maintains on the femur and the tibia. Okay. So when you fix it, you are removing, there's some laxity in the joint. And by putting in this extra capsular suture, you are recreating that stability. But it's just a suture and it can break down. So for an older, not so active dogs, is it fine? It is probably fine. But what the TPLO does, and the reason why it's such a promising, great technique, especially for bigger dogs, is that it doesn't try to fix the ligament. There's no way to really fix that ligament. Dogs' muscles are too strong, which is how it broke in the first place. If the real ligament broke, how much more so is going to recreation of a ligament with suture material or a fascial strip, which are some of the older techniques, they're going to break down. So what is the TPLO? TPLO, tibial plateau leveling osteotomy, actually eliminates the need for the ligament, period. So it changes the angulation of the joint, the tibial plateau, and basically you don't even need the ligament. And the dogs do great. So I would recommend, if it's a big dog, especially the TPLO, you can be happy to send me after the show to private message on Instagram to let me know who the surgeon is, where you live, etc. I will throw my 2 cents in. But anyway, that's kind of my feeling. TPLO is the way to go. That rhymes. TPLO, the way to go. All right. Let's see. Did I miss the flu? Yes, you missed the flu. Jill, we'll talk more about the flu updates. We'll go from there. We'll do that after the show because my time is up. A lot of visitors. Love it, love it, love it. Keep going. Tell your friends about this show, guys. I promise you it won't be wasted time. They will hopefully, at least learn something. And I learn a lot from you guys because I get these questions that I didn't think are important. Then I see that, oh my God, there are just so many of these questions. So it's all good stuff. And I'm already over time. Mark is giving me dirty looks already. Okay. No, yeah. If it's a year or two, Martin, we're going to probably want a more recent x-ray, but actually give them both because that's perfect. When you have old x-rays, we consider those the baseline. 2 years ago, now we can see, is there a change? If there's a lot of change in the x-ray, then clearly something is progressing. If the x-rays look exactly the same, then I may not be as worried. So, hi, Nikki. How's Rufus doing? Send me a note. Do you recommend closing myself into a 6-year-old? All right. That's a good question, Igor. Yes. If it's a large breed animal, and we know that there are, in the breed line or just the breed itself, there are issues. I look at it, I don't know if I have issues health-wise, but I've been taking antioxidants for 25 years, 30 years. So is that helping me not have issues? I have no idea. But do I want to stop? Heck no. So if you have a large breed, especially dogs that are known to have joint issues, and you want to put them on glucosamine now, I am a fan. It's the same thing with probiotics. People say, no, only give probiotics when you're in the midst of a problem. But is it bad to maintain a good gut balance all the time? So I'm one of those proponents that, especially if your dog's had issues before and then they start again, just keep them on probiotics. I think that's good. All right, real good. So I think we've hit everybody. I hope I've hit everybody. If there's any question that I did not get to, please reach me. You can reach me anytime. You just go to Werbs_DVM. And if you're not, I would imagine you're following me if you're here, because otherwise you wouldn't have gotten the notice that I'm on. So anyway, keep the questions coming. If I didn't get to something or you want to talk more about it privately, either reach me on my cell. Most of you probably have it anyway, or send me a note here on Instagram. For here on Pet Life Radio, I'm easy to get a hold of also. It's just Dr. Jeff, all right, at PetLifeRadio.com. I will get those emails. I love helping people with your pet's problems. And I know, veterinarians are so busy now. Honestly, they don't always have the time. So it's not like they don't care. It's not like they're not interested. They are. It's just that they're inundated. So take advantage of me because I love doing it and I'll make the time. Anyway, so either Dr. Jeff at PetLifeRadio.com, Werbs_DVM, my cell phone, Dr. Jeff at drjeff.com, Jeff at airvet.com. I mean, come on. There are so many ways to get a hold of me. Makes it so easy. Anyway, have a great week, everybody. And next week, I'm here. So actually, yes, next week, the week after that, I may not make it. I don't know. I'll be in Atlanta. And I'm depending on when my flight is, because it's a 3-hour time, it'll be noon. I may or may not make it in 2 weeks. That is the 14th, 15th, on the 17th. But otherwise, I'll be here. All right. Anyway, have a good week. And please get a hold of me if you need anything else. Take care and enjoy your day if you're here in LA, because it's gorgeous today.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.